In August, Latricia Brown was stalked and murdered in her workplace by her estranged ex-husband, Mario Green, at Henry Ford Health's main hospital in Detroit. She had been stalked for a long time and was fearful of what might happen next. She had actually been granted a personal protection order, but that order had not yet been served. In her July 20th petition for a PPO, she said, "I have tried being cordial because I feel that the system has now let me down each time that I have tried to make reports on this man. My father was murdered, and now with this situation, I am now in mental distress and scared, not knowing what to do, where I have PTSD of this whole situation. I have to constantly look over my shoulder to make sure this man is not following me to hurt me like he has done in the past with physical abuse. I am asking for help before this goes too far and things are too late." Patricia's PPO was never served on her ex-husband, and so on August 22nd, he entered the basement of the hospital, pulled out a handgun, and shot Latricia several times, and she is no longer with us. Michigan, as we've heard, is an outlier in the United States, where 43 states, the District of Columbia, and 2 territories require that PPO service take place free of charge. In Michigan, the cost to serve a PPO can include not just a service fee, but mileage traveled, which could easily amount to $100 or more. Costs vary from county to county, so a PPO survivor in one county might have to pay twice as much in another county to ensure their safety. Some counties like Chippewa, Mackinac, and Midland have already eliminated the fee requirement, recognizing that this is just good policy, and others like Antrim, Genesee, and Delta have a free or low-cost sliding scale in place. The law currently allows a victim to identify a friend or family member to serve the PPO, but that can clearly lead to a dangerous situation. So Senate Bill 611 to 612 will require that a PPO be served as soon as practicable within 72 hours at no cost to the victim by a law enforcement agency as designated by a judge. And this requirement was changed specifically due to the suggestions from the Michigan Sheriff's Association. The designated law enforcement agency would be reimbursed for the cost of service from the PPO Service Fund, which we were pleased to secure an initial $1 million, which is likely enough to cover service statewide this year. Future legislatures, though, must make sure that the PPO Service Fund is funded adequately. The Violence Against Women Act ensures that a PPO granted in one state must be enforced equally in any state. But victims in Michigan are currently being left behind if they are unable to pay to serve their PPO. I know that it takes a lot of courage for someone who is experiencing domestic violence to ask for help, to share details of what one has gone through, put it on a paper and file a petition for a PPO for a judge to consider is a truly brave and extraordinary step. So when someone is reaching out for help and trying to protect themselves, we should not put up a financial barrier to their safety. Quite simply, it is time that we remove this unnecessary and dangerous barrier for those experiencing domestic violence, stalking, harassment, or assault. And the impact of this legislation will be felt not just by victims, but also their families and innocent witnesses, like Latricia Brown's coworkers. Thank you especially to the senator from the 24th District for your partnership on this legislation, along with Wayne County Prosecutor Worthy, the Michigan Coalition to End Domestic and Sexual Violence, and the Michigan Domestic and Sexual Violence Prevention and Treatment Board. Colleagues, I urge your support for this bipartisan bill package to improve public safety in our communities and support survivors. Thank you.